Depression mood. Depression is a mental state of low mood and aversion to activity. It affects more than 280 million people of all ages, about 3.5% of the global population. Depression affects a person's thoughts, behavior, feelings, and sense of well being. Depressed people often experience loss of motivation or interest in, or reduced pleasure or joy from experiences that would normally bring them pleasure or joy. Depressed mood is a symptom of some mood disorders, such as major depressive disorder and uh, dysthymia. It is a normal temporary reaction to life events, such as the loss of a loved one, and it is also a symptom of some physical diseases and the side effect of some drugs and medical treatments. It may feature sadness, difficulty in thinking, and concentration, and the significant increase or decrease in appetite and time spent sleeping. People experiencing depression may have feelings of dejection or hopelessness and may experience suicidal thoughts. It can either be short term or long term. Contributing factors: life events, adversity in childhood, such as bereavement, neglect, mental abuse, physical abuse, sexual abuse, or unequal parental treatment of siblings can contribute to depression in adulthood. Childhood physical or sexual abuse, in particular, significantly correlates with the likelihood of experiencing depression over the survivor's lifetime. Life events and changes that may cause depressed mood include, but are not limited to, childbirth, menopause, financial difficulties, unemployment, stress such as from work, education, military service, family living conditions, marriage, etc. Medical diagnosis, cancer, HIV, diabetes, etc. Bullying, loss of loved one, natural disasters, social isolation, rape, relationship troubles, jealousy, separation, or catastrophic injury. Adolescents may be especially prone to experiencing a depressed mood following social rejection, peer pressure, or bullying. Childhood and um, adolescence. Depression in childhood and adolescence is similar to adult major depressive disorder, although young sufferers may exhibit increased irritability or behavioral discontrol instead of the more common sad, empty, or hopeless feelings seen with adults. Children who are under stress, experiencing loss, or have other underlying disorders are at a higher risk for depression. Childhood depression is often comorbid with mental disorders outside of other mood disorders, most commonly anxiety disorder and conduct disorder. Depression also tends to run in families. Personality. Depression is associated with low extraversion, and people who have high levels of neuroticism are more likely to experience depressive symptoms and are more likely to receive a diagnosis of a depressive disorder. Side effect of medical treatment. If it is possible that some early generation beta blockers induce depression in some patients, though the evidence for this is weak and conflicting. There is strong evidence for link between alpha interferon therapy and depression. One study found that a third of alpha interferon treated patients had developed depression after 3 months of treatment. Um, Beta interferon therapy appears to have no effect on rates of depression. There is moderately strong evidence that finasteride, when used in the treatment of alopecia, increases depressive symptoms in some patients. Evidence linking isotretinoin and acne treatment to depression is strong. Other medicines that seem to increase the risk of depression include anticonvulsants, anti-migraine drugs, antipsychotics and hormonal agents such as gonadotropin-releasing hormone agonist. Substance-induced several drugs of abuse can cause or exacerbate depression, whether in intoxication, withdrawal, and from chronic use. These include alcohol, sedatives including prescription benzodiazepines, opioids including prescription painkillers, and illicit drugs such as heroin, stimulants such as cocaine and amphetamines, hallucinogens, and inhalants, non-psychiatric illnesses, depression. Depressed mood can be the result of a number of infectious diseases, nutritional deficiencies, neurological conditions, and phy- physiological physiological problems, including hypoandrogenism in men, Addison's disease, Cushing's syndrome, pernicious anemia, hypothyroidism, hyperparathyroidism, Lyme disease, multiple sclerosis, Parkinson's disease, chronic pain, stroke, diabetes, cancer, and HIV. Psychiatric syndromes. A number of psychiatric syndromes feature depressed mood as a main symptom. The mood disorders are a group of disorders considered to be primary disturbances of mood. These include major depressive disorder, commonly called major depression or clinical depression, where a person has at least 2 weeks of depressed mood or a loss of interest or pleasure in nearly all activities, and dysthymia, a state of chronic depressed mood, the symptoms of which don't meet the severity of a major depressive episode. Um, Another mood disorder, bipolar disorder, features one or more episodes of abnormally elevated mood, cognition, and energy levels, but may also involve one or more episodes of depression. When the course of depressive episodes follows a seasonal pattern, the disorder, major depressive disorder, bipolar disorder, may be described as a seasonal affective disorder. Outside the mood disorders, borderline personality disorder often features an extremely intense depressive mood. Adjustment disorder with depressed mood is a psychological response to an identifiable event or stressor in which the resulting emotional or behavioral symptoms are significant but don't meet the criteria for a major depressive episode. And post-traumatic stress disorder, a mental disorder that sometimes follows trauma, is commonly accompanied by depressed mood. Inflammation. There is There is evidence for link between inflammation and depression. Inflammatory processes can be triggered by negative cognitions or their consequences, such as stress, violence, or deprivation. Those negative cognitions can cause inflammation that can in turn lead to depression. In addition, there is increasing evidence that inflammation can cause depression because of the increase of cytokines, setting the brain into sickness mode. Classical symptoms of being physically sick, such as lethargy, show a large overlap in behaviors that characterize depression. Levels of cytokines tend to increase sharply during the depressive episodes of people with bipolar disorder and drop off during remission. Furthermore, it has been shown in clinical trials that anti-inflammatory medicines taken in addition or to antidepressants not only significantly improves symptoms but also increases the proportion of subjects positively responding to treatment. Inflammations that lead to serious depression could be caused by um, common infections such as those caused by a virus, bacteria, or even parasites. Historical legacy. Researchers have begun to conceptualize ways in which the historical legacies of racism and colonialism may create depressive conditions. Measures of depression include but are not limited to Beck Depression Inventory 11 and the 9-item depression scale in the Patient Health Questionnaire PHQ-9. Both of these measures are psychological tests that ask personal questions of the participant and have mostly been used to measure the severity of depression. The Big Depression Inventory is a self-report scale that helps therapists identify the patterns of depression symptoms that monitor recovery. The responses on this scale can be discussed in therapy device interventions for the most distressing symptoms of depression.